I would like to invite Ms. Astrid Puentes Riaño in order to present the opening remark on the stage, please. Yes.
Thank you very much. Can you hear me well? Thank you very much. And it's really an honor for me to be here today. I thank you especially the organizers of this very important public seminar at the law faculty at the Chulalongkorn University. And also to Thailand CAN and OHCHR, the office in Southeast Asia, for organizing this event. And it is an honor for me to present the report on clean air and the link to the human right to a clean, healthy, and sustainable environment. That is a report that I present as a special rapporteur in Geneva last March in order to help all states, not only, of course, in the region, but also all states in the world, to understand the link, as we heard before also, that clean air is linked to human rights and how this is addressed not only by international law, but also by scientists. It's very important to have in mind that, of course, breathing clean air is essential for our life. So the first thing that I want to do before starting the presentation is ask us to take a deep breath. And to have in mind and to be aware that this very basic act in our life is the reason also that I decided to prepare this report. Because none of us will be able to live without breathing, and breathing clean air is essential for our life, our health, and the way that we live. Today, unfortunately, 99% of the population in the planet breathes polluted air, and it's that air that poses a risk to health and lives, and it's risk that it increases the risk for, especially for children, pregnant women, the elderly, people in suffering already respiratory diseases, and people living in poverty. Today, only a tiny portion of the population then breathes air that is adequate to their health and to the right to a healthy environment. Science today clearly and irrefutably, so there's no doubt to conclude that air pollution has multiple negative effects and risk on health and the quality of life on the right to a healthy environment. Because today we're seeing chronic exposures to polluted air has cumulative effects, long-term effects, and causes or aggravates strokes, heart attacks, respiratory problems, cancer, reproductive harms, dementia, depression, and development delays. So we're talking about very serious impact on health throughout the life. And also, according to the World Health Organization, between 6 and 8 million people each year die in the world because of air pollution, and many millions also lose years of life because of it. And this is globally, but it's also impacting in Southeast Asia. So without doubt, air pollution is today a serious public health crisis, but it's also a preventable and solvable crisis. And the right to a healthy environment is crucial. It's a crucial tool to solve it. As you can see here in the screen, the human right to a healthy environment has several elements. Substantive elements, as we call it, because it has to do with the elements of the relation that we have to the right to a healthy environment. Clean air is one of these elements, as healthy ecosystems and biodiversity, safe climate, healthy and sustainable food, safe and sufficient water, and non-toxic environment. But we also have procedural elements that are human rights, recognized human rights, including access to information, access to justice, and public participation. And I want to really emphasize that the right to a healthy environment has been recognized first by the UN Human Rights Council in 2021 in a resolution, and then in 2022 by the UN General Assembly in another resolution. This means that it's internationally recognized. Both of these resolutions were adopted massively by positive votes, including from Thailand, but also many other states worldwide. And the right to a healthy environment today has been recognized by 165 states, which is 85% of states in the world, but also regionally. It has been recognized since the 80s by the Inter-American system and also the African system on human rights, and also in ASEAN in 2012, and recently by the adopted resolution in last October on the right to a safe, clean, healthy, and sustainable environment. At the same time, the right to a healthy environment was recognized by the International Court of Justice in the recent advisory opinion that was published last year, where the International Court of Justice concluded that the right to a healthy environment is a precondition, is inherent, and is essential for the enjoyment of all other human rights. And it's directly interconnected with other human rights. So there's no doubt that under international law, and now we have the International Court of Justice in The Hague, we can't go higher. That's the highest court internationally, recognizing that the right to a healthy environment is part of international law. So then why healthy environment is important to clean air? As I mentioned, it's part of the substantive element of the right to a healthy environment, and it is especially important considering today that we're living a triple planetary crisis. That is an existential crisis for humanity because it has to do with climate change, biodiversity loss, and toxic pollution, and is aggravated by inequalities. As we heard before in the opening remarks, as we all breathe, it's not the same situation for everyone because it has to do with the differentiated impacts. So breathing clean air is vital for everyone. And as I mentioned, it also is linked with equity and justice because highly polluted areas are home today in the world to 716 million of the world's lowest and incomes people. And the most affected people and communities are frequently also marginalized, which means that structural inequalities deepen the problem and aggravates it. Inadequate nutrition, for example, inexistent or inadequate access to health and care systems and access to information increase the harms that people are living. And health impacts from prolonged air pollution exposure in these communities include elevated rates of asthma, bronchitis, lung cancer, lead poisoning, heart disease, and other chronic conditions. Proximity to the sources of pollution is the most decisive factor determining who breathes clean air and who doesn't breathe clean air. And the evidence highlights that inequality also is reflected in the distribution of harms and risks because the highest, most dangerous levels of air pollution occur in low and middle income countries and especially in urban areas. 92% of premature deaths related to air pollution are occurring in low and middle income countries. And the fact that vulnerable populations suffer disproportionate harms also affects their rights to equality and non-discrimination and is today putting a burden in the health systems. So health systems are paying a lot the cost of the impacts from air pollution. And this vulnerability, as I mentioned, means that there's differentiated impacts. But the impacts also are transboundary, and that is one of the things that is impacting this region specifically. Because air pollution that is impacting one country can affect other countries. And we're seeing this both in ASEAN, but also, if you can remember, fires from Australia, Greece, Canada, Brazil, Indonesia, and Malaysia in the region as well are having cross-border impact. And this is one of the key aspects that needs to be addressed and improved. As I mentioned in the report, and this is one of the key aspects, because of this transboundary impacts is also linked to the obligations of the states to make sure that they prevent impacts that are transboundary, but they also implement effective actions to address this. As I mentioned, there are groups in population that are more vulnerable to air pollution, and these include children, people during pregnancy, pregnant people, people with pre-existing conditions, and older people. Children are more vulnerable to air pollution because their bodies are developing and their immune system is not fully formed. And so this means, of course, that in their bodies, if they breathe polluted air, it has an increased impact in their life. In 2021 only, approximately 700,000 children under 5 years old died in the world from preventable causes linked to air pollution. This means that it's nearly 2,000 kids per day. Because of this, it's very important that states implement effective measures addressing specifically the needs and the specific risks of populations that are more vulnerable to air pollution. And air pollution also impacts all organs in our bodies and throughout our life. This slide is a graphic from a report that is called Cradle to Grave, and it evidences that the air pollution is not only impacting our lungs and the respiratory system, that sometimes we all know that this is happening, but impacts are also reflecting in including increase of strokes, heart attacks, respiratory problems, cancer, reproductive harms, dementia, depression, and development delays. So that is why it's very important to immediately and effectively and urgently implement actions in relation to air pollution. So thinking about the impacts now, it's very important to think about the sources of pollution. And this has been significantly concluded by scientists all over the world, that global air pollution is caused and linked specifically with fossil fuel power transportation, fossil fuel derived electricity, fossil fuel production, residential heating and cooking with coal or biomass, human-driven fires and agriculture, and even consumer products and the use of fireworks. Sometimes in cities, and it happens also in Mexico City where I live, or in Delhi, in holidays people use a lot of fireworks, and that is of course worsening the pollution that the cities have. But specifically, and I want to highlight this, the use of fossil fuels because of electricity or transportation is one of the drivers, and this means that these should be the priority actions that states implement to make sure that the effective actions are implemented. And now I want to summarize the obligation of states in relation with air pollution, and based on international law. There are many obligations of states, specifically starting with the obligation to protect the environment and to prevent significant harm. And this is one of the obligations also. The International Court of Justice from The Hague concluded that there is an obligation to prevent harm that is based on customary international law and is an erga omnes obligation, which means that all states have this obligation only because of being part of the international community. And this obligation also applies, and especially to transboundary harms, including, as I mentioned, air pollution. States also have the obligation to act with stringent due diligence. And this stringent due diligence is based on the significant risk that climate change and other impacts on the environment can have. And the risk must be based in base available science and consider probability, foreseeability, severity, and the magnitude of the potential harms. And when we talk about climate change and the link with air pollution, we're talking about significant harms, including, as I mentioned, loss of lives. States also have the obligation to regulate and to take measures to effectively control industrial contamination, both from single sources and also complexity of activities, and to guarantee healthy air that must, and this means providing effective deterrence and timely and appropriate and consistent actions to make sure that air pollution is effectively controlled. States also must refrain from contributing to air pollution. There is also an obligation to prevent risk, and this is important also considering the human rights perspective. Because sometimes when we talk about the responsibility of state or non-state actors, there is under civil law the request to prove the harm. But I want to highlight, and this has been also concluded internationally by regional human rights systems, including in the Inter-American system and the European system, that when there is a severe risk, the obligation of states is to prevent the risk, not wait for the harm to be done in population. And there are regional conclusions in these litigations in the human rights system, including in the Inter-American system and the European system, that have concluded that when there is a significant risk to human health posed by pollutants, and these risks have been proven, when there is also demonstrated exposure to pollutants in conditions that endanger health, and that there's a proof that the state has breached the obligation to prevent environmental pollution, then in these situations, victims do not need to prove the direct link between the alleged health impact and the exposure. In these situations, it's the burden of proof changes, and it's all then for the state to prove that there was no responsibility. There's one thing that I also want to highlight, and is that scientific uncertainty cannot be a justification for inaction, because when there are risks for significant or irreversible harm, states must act promptly and apply the precautionary principle. And also effective and enforcement and monitoring is indispensable to ensuring compliance with safeguarding health. There are key tools that states have, including integrating and making sure that our environmental, social, and human rights impact assessments and climates needs to be considered when there are projects that might be implemented. I want also to share a few good practices, because there are good practices that we can learn from, and I highlighted a lot of them in the report. For example, when we are thinking about the implementation of urgent measures and reflected from policies and concrete results, there are examples like in China, where clean air policies achieved the reduction of PM 2.5 related diseases by 30% between 2013 and 2017, and by 2024, this reduction has been on 36%. So it evidences that when there is will and adequate policies, the pollution can be reduced with a very significant positive impact on health. In Japan, where major pollution epidemic respiratory diseases also were reflected, authorities used the polluted pay principle and her responsible parties for accountable remediation and restoration and compensation for victims. And there are also key examples from cities, because cities and urban areas are key. London, for example, has been implementing ultra-low emission zone policies, which it means that they are restricting traffic in some zones, and this was made because of children's health. And so they have been scientifically following up the health of children, specifically in relation with lung growth, and only in a few months, the consequence of the ultra-low emission has shown an improvement in lung growth in children, and then this means better health for children in only a few months. The City of London improved and achieved their objectives by 200 years early because of these policies. So we can see that it's possible to be reflecting. Investments also to reduce pollution generate tangible and rapid improvements, like in Ulaanbaatar, Mongolia, where the shift from use raw coal to cleaner fuels improved 51% of reduction during winter of PM particulate matter levels over a 3 period of time. And then in India, more than 70 of households are now receiving clean cooking subsidies, and this is also improving health. In Nigeria, also cooking with ethanol stoves today has improved infant health. And in Kathmandu, they replaced 700 diesel units with electric three-wheelers, and this is not only helping with clean air, but in traffic and in general, the city. So there are many examples like this. In Nairobi also, there are improvements with using low-cost monitoring, because one of the arguments is that improving clean air is very expensive. But there are many examples, including using low-cost monitoring to be able to have better data and improve these actions. This has been done in Nairobi, in the Philippines, and in Poland as well, incorporating also civil organizations and civil society organizations in air quality for better air quality monitoring. So I want to also go back as the UN, of course, Rapporteur on the Human Rights to Healthy Environment, how this is very important under international law, the obligation of the states and the understanding of the obligation of the states, and to make sure that this is implementing nationally. And as I mentioned, this is an erga omnes obligation that has to be, and it applies also for transboundary harms. But businesses are also part of the problem, and they can also be part of the solution. In the report, I included several conclusions and recommendations for businesses. And I want to highlight that the private sector has a role to contribute with avoiding the causing of harms and contributing to better actions. But they also have the obligation to conduct and act with due diligence and to provide remediation whenever their activities are impacting health. One of the things that I learned preparing the report is that subsidies worldwide need to shift. As you can see here in the slide, between 2018 to 2024, worldwide, $60 billion were spent to subsidize fossil fuels, $600 billion. And there are other numbers that talk about trillions. So the message that I want to share with you today is that meanwhile, only $3.16 billion each year were used for on air pollution control. So if we do the numbers, this is approximately 0.52% of money that was used for controlling air pollution. 0.52 is corresponding as opposed to what was used to subsidize fossil fuels. So the money is there. We need to make sure that states and the industry shift the subsidies and the incentives instead of the drivers for air pollution to solve the situation. There are a lot of situations, as I mentioned, that I want to highlight. Air pollution is a crisis that is solvable and preventable. And there are trillions of dollars already also that are linked to the losses from air pollution. 8.1 trillion US dollars is what air pollution is costly in mortality and morbidity. So it is not free. Air pollution is costing lives, years of expectancy, children's health and other populations, but also it's costing money. In the report, and I'm not going through all of this in detail, but in the report I included several recommendations to states. One of the key aspects that we need to make sure that it happens is that the policies, regulation, and actions are done that are related with air pollution are done with a human rights-based approach. What does this mean? This is not only a technical conversation. We're not only talking about PM 2.5 and what is the standard and what is the limit. These regulations must include the right to a healthy environment, the right to health, and the risk that children and other communities and populations have. We also need to make sure that regulations are updated to include World Health Organization guidelines and make sure that those are the minimum guidelines and limit for standards that must be incorporated. Also making sure that there are monitoring programs and these are updated constantly and that information is public. Of course, when we talk about air pollution, this is a very big and complicated situation, but it's very important to prioritize where the situation is worse. This is identifying hotspots and then prioritize those hotspots first and make sure that action plans are for this. And as I mentioned, this is not only a situation for national government, cities and metropolitan areas have a huge role as well. And in these, I included specific recommendations for cities, including the importance for shifting to better healthy alternatives, strengthen fuel quality, and of course, increase in public transportation systems that are healthy, that are sustainable, that are efficient, that are not dependent on fossil fuels. One of the things that needs to happen in cities, and again, I live in Mexico City, is that we need to shift from the dependency of private cars, especially linked to fossil fuels, but also increase the reliables and dependent on good public transportation. Regulating polluted products is very important, and as it is including impact assessments and the incorporation of health issues in there. And businesses, as I mentioned, are key that they have to comply with air emission standards. Sharing data, access to information, public participation, and access to justice is key. Access to information is a human right, and it's also a responsibility, and businesses have the responsibility to share the information about how their activities might be impacting air and improving this, and sharing also the data on how they're doing. Businesses also have the responsibility to protect their workers and employees, both from indoor and outdoor contamination, and make sure that workers are protected and in healthy conditions. And one of the key aspects, unfortunately, that we're seeing is the undue influence from businesses sometimes, either for preventing better air quality measures or laws. So it's very important for businesses as well and sectors to abstain from undue influence or misinformation campaigns that prevent governments to improve the areas. So there are many things, of course, that need to be done, and I wanted to here to prioritize and a little bit more effective and identify areas that must be done. So we need better enforcement, we need better policies for health. States need to, and we all actors need to improve understanding of the importance of clean air and the link between human rights and actions that need to be done. Information and transparency needs to improve as well, and the strong legal frameworks. So I grouped the recommendations in these 5 groups of actions: enforcement, policies for health, understanding, information and transparency, and strong legal frameworks, so that we can understand this group of actions and make sure that advancement and information is strengthened. On this, I want to also share that in addition to preparing the report on clean air, I also, with the support of some colleagues, prepared a version for children that is here, that is now in English. It's also available in Spanish, French, Portuguese, and Purépecha, that is an indigenous language in Mexico. And I really hope that it will be available soon in Thai, so that kids, it's downloadable. It can be downloaded as an activity book for children, because this is not only difficult and complicated situation and topic. It is something that we all must understand and that children must understand, so that they can also implement actions to improve and be able to breathe clean air. And I invite you to download it, and of course when it's available in Thai, I will share it. And with this, I want to thank you very much for being here, for listening, and for your work also towards clean air. That, as I said, it's our human right, and I really hope that very soon we can breathe cleaner air so that our right to a healthy environment is guaranteed. Thank you very much.